Let's talk about chemotherapy and how it works. Chemotherapy works by targeting cells that divide quickly, like cancer cells. But there are also other cells in your body that are dividing quickly, like your hair, skin, nails, the lining of your mouth, esophagus, stomach, colon, and your bone marrow, where your blood is made. It can cause many different side effects. In this video, we will cover some general side effects of chemotherapy. Your provider will be in after to discuss things in more detail and what is specific to you and your chemotherapy. Our strong suggestion is to take one day at a time and keep an open communication between you and your cancer therapy team. Let's talk hair. It's not always common to lose your hair. You may have some hair thinning, but complete hair loss is not always seen. Sometimes hair starts to grow back during your treatment. This does not mean that the chemotherapy is not working, but just that those follicles are already stimulated. Your skin is thinner on therapy, which makes you more susceptible to cuts and bruises as well as the sun. If you're going to be in the sun, we recommend wearing sunscreen at least SPF 30+, and consider wearing long sleeves and trying to stay in the shade, especially during the summer months. It is possible to develop a rash while on treatment. If you develop a rash, do not put anything on it. Notify us so we can treat it appropriately. With some chemotherapy treatments, you may see the skin on your hands or feet darken. Your nails may become more brittle and thinner while on treatment. We do not recommend manicures or pedicures due to the risk of infection. We usually recommend keeping your nails short and using hydrating creams like CeraVe, Cetaphil, or Aquaphor for your hands and feet. Notify us of any potential signs of infection. Human mouths are naturally full of bacteria. Good oral hygiene is encouraged while on chemotherapy. Rinsing after you eat and before bed with a homemade rinse of water and baking soda or salt can be helpful. You can also use biotin over the counter. Avoid any mouth rinses with alcohol as it can burn and be painful. In practicing good oral hygiene, we can decrease some chance of developing mouth sores, but sometimes even with good oral hygiene, patients will still get mouth sores. If you develop mouth sores and it is too difficult or painful to eat, please let us know. We have numbing medication we can prescribe to help with the oral pain. Patients on chemo will also sometimes develop oral thrush. Thrush looks like a white film over the tongue and cheeks. It can make your mouth dry and alter the taste of food. Please let us know if you are concerned you might have thrush, as this is treatable with a prescription medication. Your gums are also thinner during treatment, so we recommend using a soft bristled toothbrush. The lining of the esophagus can also be thinner during chemo, but the stomach still produces stomach acid, which can create heartburn. Additionally, with some treatments, steroids are given, which can make heartburn worse. If you find yourself noticing heartburn symptoms, let us know. We can prescribe something to help. Nausea is a common side effect of some chemotherapy drugs. With most chemotherapy, IV nausea medication is given before your treatment, something you may hear us refer to as a pre-med. You will also be prescribed medication to use at home for nausea as needed. If your nausea medications are not working well enough, please call us so we can add to them or change them. It is important to control your nausea so you can continue to eat and drink normally. Chemotherapy can cause constipation or diarrhea. If you develop constipation, you can use over-the-counter products like Miralax or Senokot. If you develop diarrhea, we recommend Imodium. Make sure you follow the directions on these over-the-counter medications. If they're not working, please notify us, as we have stronger prescription medications we can send to your pharmacy if needed. If you are having significant diarrhea, you may be at risk for dehydration and may need to be evaluated for IV fluids. So please call us so we can help arrange for that if needed. Chemotherapy can affect the bone marrow where your blood cells are made. The three main types of blood cells are your red blood cells, your white blood cells, and your platelets. When your white blood cell count is low, you are at higher risk of infections. Consider wearing a mask, practicing good hand washing, and avoid being around those who are sick, because you will be at greater risk of getting infections and may have a harder time fighting off infections. Anytime you are concerned, you are sick, and especially if you have a temperature of 100.4, not 104, but 100.4 or greater, you need to call us. When your red blood cell count is low, this is what we call anemia, and you may be more fatigued. We want you to stay active throughout therapy to prevent deconditioning. However, you may need to take more breaks or rest periods. If you feel like you are struggling to maintain your daily activities, talk to us. We have certain programs to help prevent deconditioning. When your platelets are low, you are at higher risk of bleeding. Blood in your urine or blood in your stool is abnormal, so please let us know if you see this. Nosebleeds are also common. If you have a nosebleed, pinch and hold it. If you cannot control it, call us. Nutrition is important while on chemotherapy, and we recommend a well-balanced diet, making sure to get enough protein and calories daily. Protein is important to help maintain muscle mass throughout treatment. If you are struggling or losing weight, let us know so we can make a referral to a dietitian. We do recommend that your meat be cooked to the correct internal temperature. You can have fresh fruits and vegetables as long as they are washed well. Sometimes it helps to break up your meals from 3 large meals into several smaller meals. If your oral intake decreases, we recommend supplementing it with some sort of protein shake, such as Boost, Ensure, Carnation Instant Breakfast, or a homemade protein shake. It is important to stay hydrated during treatment. We recommend drinking 64 ounces of water a day unless you are on a fluid restriction for another health condition. If you are on a fluid restriction, please make sure to let us know. Coffee, tea, and soda do not count toward your 64-ounce goal. If you do not like the taste of water or the taste changes, consider adding flavoring to your water, such as Mio, Liquid IV, Crystal Light, or even fruits to your water. Your provider will be in shortly and can go over any additional questions you may have.